Uterine fibroids are common benign tumors that grow from the muscular wall of the uterus. Fibroids may cause heavy bleeding, pelvic discomfort, pelvic disfigurement, anemia, and create pressure on other organs. Currently, the most common treatment for fibroids is a hysterectomy. In fact, 1 out of 3 American women by the age of 60 has a hysterectomy, and the most common indication is fibroids. However, there are now minimally invasive uterine-sparing procedures to treat fibroids, such as uterine fibroid embolization.
This is the fibroid embolization we perform today.
Uterine fibroid embolization, or UFE, is a uterus-sparing, minimally invasive procedure used to treat symptomatic uterine fibroids. It is a catheter-based procedure performed by an interventional radiologist. During UFE, a catheter is guided into the uterine arteries. Tiny beads are then injected via the catheter into the blood vessels that feed the fibroids. Over time, the lack of nourishing blood causes the fibroids to shrink, resulting in a dramatic reduction of common fibroid symptoms. UFE is not recommended for women who are pregnant or who wish to get pregnant. Prior to undergoing a UFE, patients are put under conscious sedation as well as given a local anesthetic to the pelvic region. A small nick, approximately 2 to 3 millimeters in diameter, is then made in the patient's groin. The interventional radiologist then guides a very thin catheter and guide wire into the incision, through the femoral artery, and up into the main uterine artery. Once inside the main uterine artery, the catheter is placed into the right and left uterine arteries. Pictures are taken to determine the best position for the catheter in order to accurately perform the embolization. Next, the material used to block the blood vessels feeding the fibroids is prepared. Embosphere microspheres, the first cleared embolic material for UFE procedures, are most commonly used. Embosphere microspheres are round, hydrophilic beads made of an acrylic copolymer. The smooth, round surface of the beads prevents clumping within the catheter and the blood vessels, promoting ease and accuracy of delivery, and ensures that the vessels are uniformly blocked. In addition, the elasticity of the microspheres facilitates passage through small delivery systems. Prior to injection, the microspheres are loaded into a syringe and contrast is added to make them more visible. Once the embosphere microspheres are ready, they are injected very slowly to ensure that they are delivered to the correct blood vessels. Once the embosphere microspheres are in place, the interventional radiologist will then insert a contrast dye into the same blood vessels to make sure that they have been completely occluded and no blood is reaching the fibroid. Following the procedure, the patient is given pain medication and usually stays in the hospital overnight. It is common for patients to experience some post-procedure pain and nausea. The overall recovery period for UFE is short in comparison to surgical methods to treat fibroids, and most women who undergo the procedure return to their normal daily activities within days. Women interested in uterine fibroid embolization should talk with their gynecologist or interventional radiologist to see if